Ladies and gentlemen, family and friends, scholars and dignitaries, welcome to another episode. Welcome to my world. So, over the years, I've had the opportunity to know several parents that had children who were born with fetal alcohol and drug effects, FADE. I can't begin to express my concern for these children and for their parents who have this permanent disability and whose life is a struggle and a challenge each and every day. Every pregnant woman wants a healthy and normal baby, but one of the primary causes of birth defects, and the only one which is 100% preventable, is alcohol and drugs. You need to be informed and concerned with the kinds and amounts of drugs you take, including alcohol, street drugs, over the counter drugs, and all medications. So, substance abuse during pregnancy can cause lifetime birth defects, and in fact, fetal alcohol syndrome is the number one cause of mental retardation and the only cause which is fully preventable. Fetal alcohol and drug effects, FADE, is the single most preventable cause of birth defects. In the United States, 20% of pregnant women smoke cigarettes. Another 18% drink alcohol during pregnancy, and another 5% use marijuana throughout their pregnancy, and as many as 6% of women use an illicit drug at least once while carrying a child to term. And the medical needs for FADE babies and children are so great. The lifetime cost for medical services and special education for a FADE child may be well over $2 million per child. Together, some 90% of pregnant women drink, take prescription or non-prescription drugs, or use illicit drugs at some point during pregnancy. One estimate is that each year about 500,000 unborn children are exposed to psychoactive drugs. Health professionals discourage any drug use during pregnancy unless necessary because of potential harm to the fetus. Some drugs are harmful when used at any time during pregnancy, and others are most damaging at specific stages. Legal substances such as alcohol and even medical drugs, both prescription and over the counter, can be very harmful to a developing fetus. And of course, illegal drugs such as marijuana, heroin, and cocaine all pose dangers to a pregnant woman. An expectant mother needs to be informed about all drugs, and for maximum health, a woman should avoid all substances and medications unless, again, by the prescription of a physician. First, take alcohol. Babies whose mothers drink alcohol during pregnancy may be born with fetal alcohol syndrome, with characteristics of small head and body size, abnormal facial characteristics, behavioral problems, mental retardation, learning disabilities, and a failure to thrive pattern. Even light or moderate drinking during pregnancy can cause fetal alcohol effects or alcohol related birth defects with physical abnormalities and behavioral problems. One in every 1,000 babies is born with full fetal alcohol syndrome, and one in every 100 may be born with some level of fetal alcohol spectrum disorder. The degree and severity of these effects can vary from very mild to severe and can include physical, mental, behavioral, or learning disabilities that may be lifelong implications. And this is very important. There is no known safe dose of alcohol that can be consumed during pregnancy. FAS is 100% preventable if a woman does not drink alcohol during pregnancy. So it's very important that any woman who may be pregnant or trying to get pregnant totally abstain from all alcohol consumption. Even the Surgeon General issued an advisory which states in part, alcohol can damage the embryo or fetus at any stage of pregnancy. No amount of alcohol consumption can be considered safe. Damage can occur in the earliest weeks of pregnancy, even before a woman knows she's pregnant, and the cognitive effects and behavioral problems resulting from prenatal alcohol exposure are lifelong. That means they're permanent. Now, the second most commonly used drug is nicotine and tobacco. Here, maternal cigarette smoking causes low birth weight, increased incidence of premature birth, and retarded fetal growth. Smoking during pregnancy causes a higher percentage of stillborn babies and miscarriages. Smoking is more likely to result in low birth weight babies that are greater risk of dying soon after birth and is implicated in SIDS, sudden infant death syndrome. The next most commonly used drug is marijuana. At least 5% of pregnant women use marijuana throughout their pregnancy, and that number is growing both with medical marijuana and the legalization of marijuana. Marijuana affects the development of the fetus and can even have a substantial impact, resulting in attention deficit disorder, cognitive functioning, and characteristics such as exaggerated impulsivity as your child grows. Pregnant women who smoke marijuana are frequently at higher risk of stillbirth, miscarriage, low birth weight babies, and fetal abnormalities, especially of the nervous system. Well, how about the other drugs? Infants born to mothers who have used cocaine during pregnancy can suffer a number of complications, including prenatal strokes, kidney and breathing disorders, risk of miscarriage, premature labor, and a condition called abruptal placentae, which is the separation of the placenta from the uterus wall. Growth may be hindered, and babies are at risk for sudden infant death syndrome. A baby may also be born cocaine dependent and experience painful withdrawal after birth. Some experts believe learning difficulties may later develop. Heroin and narcotics. Infants born to women addicted to heroin and other narcotics have a greater risk of complications, be stillborn, have a low birth weight, a danger of premature birth, breathing difficulties, or bleeding within the head. They have poor motor coordination and may exhibit delayed mental and motor development. Often the babies of narcotic addicted mothers are born addicted and suffer withdrawal. Also, women who use narcotics by intravenous injection may have the HIV virus and risk passing that virus on to their babies. Methamphetamine, PCP, inhalants, steroids, over the counter drugs. Meth use during pregnancy can affect development of the brain, the spinal cord, heart, and kidneys. It can cause a number of pregnancy complications, including developmental and skeletal abnormalities, such as clubfoot, and some babies are born without parts of their arms or legs. Inhalants can cause malformations and birth defects. PCP can cause withdrawal symptoms. Steroids have been implicated in causing low birth weight babies and particular defects, such as cleft palate. And many other medications, both prescription and over the counter drugs, can cause a number of different side effects potentially harmful during pregnancy. So, any drug use during pregnancy can place a fetus at high risk for numerous complications and birth defects, including mental retardation, gross malformations, and behavioral disorders. And many of these characteristics are permanent and cause lifelong hardships. The use of any drug during pregnancy, unless by doctor's prescription, should be avoided. And here is one area in particular where simple prevention can prevent complications and an enormous emotional lifetime cost for both parents and children. A final point that needs to be discussed is the whole dynamic of addiction. Regular drug use throughout a pregnancy can produce addiction in the newborn, and the baby may go through a very painful withdrawal process upon birth. Recent data has shown that not just the use of alcohol or opioids, but of many other drugs throughout pregnancy can cause this addiction. The type and severity of an infant's withdrawal symptoms depends upon the drugs used, how long and how often the mother used, how her body breaks the drug down, and whether the infant was born full term or prematurely. Sometimes the symptoms of drug withdrawal in a newborn can develop immediately, and sometimes it can be days later, even up to 14 days after birth. But in either case, drug withdrawal is not an easy syndrome for a baby to go through. Every mother wants a healthy and happy baby. Remember, there is no safe time or safe amount to drink, smoke, or use illicit drugs during pregnancy without the possibility of causing birth defects. You can say no, your baby can't. And women who have difficulty in abstaining from alcohol or other drugs during pregnancy should contact a local treatment agency. It's never too late to seek help. Your baby's life may just depend on it. Hey, be safe, be well, and God bless.